Okay, good morning, everyone. This is Jim Wood with Common Ground Healthcare Cooperative. We want to thank you for taking time out of your Saturday morning to join us today for our Insurance 101 presentation. Really, the goal of this session is to hopefully provide you with a better understanding of your insurance policy with Common Ground and how to use it most effectively. And if you do need assistance from us on our end, how to get a hold of us and for what reasons to get a hold of us. So just a reminder here on the first slide, please keep your microphones off and submit all questions in the chat box. So if you look at your screen at the bottom, kind of in the middle, there's a chat box. To open the chat box, hover over that black bar on your screen and click chat. Then type your question and click enter on your keyboard. We will address as many questions as possible at the end of the presentation. So if you have a specific question regarding your personal medical needs, we ask that you call our member services team at 877-514-2442 or email us at info@commongroundhealthcare.org with the subject line, Insurance 101 for assistance. And if you would like someone to call you back, please state that in your email and with a good time and date time frame that we can get on back to you. So thank you for that. We do respect your privacy, especially if it's a specific medical situation. So, by either giving us a call or sending us an email, we can help you to protect that personal privacy. And also, we do advise that you stick around to the end of the presentation for a chance to win a $50 Target gift card. So welcome to Insurance 101 from Common Ground Healthcare Cooperative. One of our missions from an organizational standpoint is putting members first. So we'll go over our agenda really quick. We're going to talk about the Common Ground's history and mission. We're going to touch on some key health insurance terminology, review general coverage and benefits. As I mentioned prior, let you know the contacts and the resources that are available to you as a member of Common Ground. And also, from a member standpoint, how you can get involved with the organization. So a little bit about our history. Common Ground was founded as a nonprofit cooperative in 2014 by community members who contributed their time, their expertise, and financial support to get Common Ground started. So we're located in Brookville, Wisconsin. That's about 20 minutes or so due west of Milwaukee. So what's nice about Common Ground is that we're a local state-based company. So as employees, we and our families, especially if you live in Southeast Wisconsin, we get our medical services through many of the same doctors and hospitals and clinics and pharmacies that you do if you live here in Southeast Wisconsin. And another nice thing about being local is that, regardless of where you live in the eastern part of Wisconsin, whether it's Kenosha or Manitowoc or Oconomowoc or Kaukauna or Wapaka, we know where those places are and we even know how to pronounce them. So it's kind of nice to have somebody from a company that's locally based to assist you, with your needs when it comes to health insurance. So advocating for members is a top priority for Common Ground. We are a nonprofit, so we're different from, I would say, almost any insurance company on the eastern part of Wisconsin that you might deal with or be aware of. So we are a nonprofit. Obviously, we have an executive team, but the other unique thing about Common Ground is that we have a board of directors. There are 9 members, and to be on the board, you have to have coverage with Common Ground. So either individual insurance or you're a business owner that has group insurance with us. And so these folks, are engaged in the operation of the organization, and they work hand in hand with the executive team to help set the direction of the company for the best interests of the members. So 2 quick things I want to mention is that in the last 2 years, in 2018 and 2019, we did send out medical loss ratio rebate checks, and that's because of the requirements of the Affordable Care Act. Insurance companies have to have a loss ratio of 80% or more. Because of operating efficiencies, we actually were a little below that. in 2018 and 2019. So in the last 2 years, anybody that had coverage with us in 18 or 19, whether it was for a month or for the entire calendar year, January through December, they received a rebate check based upon the percentage of premium that was due on a monthly basis. So that's kind of a unique thing that we've done as a company out there. And so it's one of the advantages of being a member of Common Ground. If in a given calendar year, we are below that loss ratio amount. And also in the last 4 years, 2017, 2018, 2019, and 2020, we were voted as a Journal Sentinel top workplace in the Milwaukee area. I've been with the company about 4.5 years. It's a great company to work with. A lot of very experienced and dedicated people who really do live the mission of trying to put members first and help you as best we can with your health insurance needs. So our mission, putting members first, pursuing better healthcare. That really is our mission. Again, as a nonprofit, we put our resources toward improving admin services. We're trying to keep the pricing as competitive and as low as possible through our day-to-day operations and our budgeting and our forecasting from an organizational standpoint. So we're going to touch on some health insurance terminology, things such as plan terms, what FFM and APTC mean, and also service terms with the organization. So let's take a look at some pretty major health plan terms. So the premium. Pretty sure everybody understands what the premium is. That's the amount that you pay for your health insurance every month. So we're going to touch on down the road, the different ways to pay. But yeah, that is the amount that you get invoiced and you pay Common Ground on a monthly basis. The copay is the fixed amount you pay for covered health services. So many of the plans do have copays, some of them don't, and the copays are primarily going to apply to seeing a primary care doctor or a specialist, or the first 2 levels of prescription drugs. Deductible. That's the amount you paid for covered services before your insurance plan begins to pay. And on the next slide, we're going to kind of go through, kind of how that works to give you a visual example of, kind of how that a copay or premium and deductible works. Coinsurance. That's the percentage of cost of a covered health service you pay after you've paid your deductible. So if you have a set dollar amount of a deductible, you meet that first. That's your initial out-of-pocket expense. And then the coinsurance, that's the additional percentage you pay after you meet your deductible that you pay until you hit your out-of-pocket maximum. Now, the maximum out-of-pocket, that's the most you pay for covered services in a plan year. So all the plans from Common Ground run from January through December. Some folks might get in, in February, March, or June, but whether you get in at the start of the year or sometime during the year, that plan's lifespan is until December 31st of that year. Okay, so on the next slide, we're going to talk a little about kind of what the plan looks like. So this is an example of a scheduled benefits. I mean, this is information that if you went to our website or have gone out there, this is something that you could pull up and look as it relates to your specific plan. So in this instance, we're looking at a Silver 4000/75 plan. So on the first line that's highlighted, that's the deductible we're talking about. So the calendar year is a calendar year deductible. It runs from January 1st through December 31st. So in this particular situation, if you're a single individual, your deductible on this plan is $4,000. If you're a family, and a family can be a husband and wife, a husband and wife and kids, or a mom or dad with kids or dependents. So, so $4,000 on the single, $8,000 on the family. So after you've satisfied whatever deductible applies to your plan, then you have 25% coinsurance, which means that let's take for a single person with $4,000 deductible, after he or she satisfies that $4,000 deductible, until they have $8,550 of total out-of-pocket expenses, which is your out-of-pocket max on line 3, you pay 25% of each dollar of additional covered services in network. We pay 75% until you hit that $8,550. After you hit that maximum out of pocket for the calendar year, all eligible in-network services are paid at 100%. And on the next line, we'll talk a little bit about the copay. So a lot of plans have copays, some of them don't. In this example, if you go to see a primary care doctor, there's a $50 copay, which means that, okay, if you go, let's say to an Aurora, a Bella, Medicare primary care doctor, there is an office visit charge to go and see that doctor, in addition to anything else that he or she might provide to you from a service standpoint. So that $50 copay is what you're charged to go see that primary care in-network doctor on this particular plan. So federally facilitated marketplace. So whenever you hear or see the term FFM, that's what it means. It's also known as Obamacare, the Affordable Care Act, or the exchange. So when you apply for individual and family coverage through the marketplace, they're going to ask you to provide income and household information, okay? And they do that because they want to find out if you qualify for a premium tax credit or other savings that will make the health insurance more affordable. So to apply for coverage through the exchange, you actually go to healthcare.gov. You may have done it yourself. You may have worked with an agent to go out there and set up your application. I just want to remind you that whether you go directly to the marketplace or you work with a broker who is local and can be a local person to work with on setting up the most suitable plan, the price is the same. You don't pay any more for working with a broker than if you go it on your own. So I just wanted to make that comment so everybody's aware of that. So the APTC, that's an advanced premium tax credit. So that is a federal tax credit in the form of a dollar amount that reduces the amount you pay for monthly health insurance premiums when you buy a health insurance plan on the marketplace. So to qualify for an APTC or a tax credit, the marketplace is going to ask for information such as, what is your household income? What is your household size? Is it just you in the home? Is it you and a spouse? Is it you and the spouse and 3 or 4 kids? And they're going to ask for your household size. And they're going to look at the age of the household members. And so they have a formula they use to determine, whether or not, depending on that criteria, if you're going to qualify for a tax credit. And if you do, they're going to tell you, that yes, you are eligible. You're going to get a confirmation that you're eligible. And they're going to tell you how much you get to utilize each month to apply towards your plan to reduce your premium. So an example would be, let's say that you picked a plan, and based on the information you provide on your application, your monthly plan cost or premium, the base amount is $560. But you qualified for a tax credit or an APTC of $358. So what we do then is we take that base amount of $560, we subtract your tax credit because that's a credit you're getting. And so the total amount that you pay on a monthly basis is $202. So when you receive an invoice from Common Ground, that monthly amount is going to be $202 because you're getting a portion of your premium subsidized, which is making it hopefully a lot more affordable for you to get into that plan and maintain it during the course of the year. So health services. They are services, supplies, pharmaceuticals, or prescription drugs that are medically necessary by the healthcare plan according to the terms and conditions in the certificate of coverage. So if anyone's ever gone to our website, whether you're a member or you were shopping for health insurance before you joined as a member for Common Ground, you can actually see a certificate of coverage. And it's the same for everybody. So regardless of the plan you have, the certificate of coverage, it's 100-some pages. We don't print it out, but you can go onto the website and read it in detail. It'll tell you all the things that are covered. It'll tell you the things that aren't covered. It'll tell you process and procedures that you and we follow as far as making sure that the plan works most effectively for you. And so these services, these covered services, they're applied toward your deductible and coinsurance and are paid by your health plan based upon your specific plan benefits. So a couple of examples are things that are covered in the plan, x-rays, medication or prescription drugs that you go pick up at Walgreens or CVS or a Meyer, CT scans, transplants, surgeries, CPAP machines if you have a sleep disorder. So it's a pretty extensive list of things that are covered on the plan. And if you want to see the detail, you can go and look at the certificate of coverage. And we'll talk about some other ways that you can get assistance if you have any specific questions that relate to your personal situations. So preventive services. These are services or drugs, prescription drugs, that are used to prevent cause of illness or injury and are clearly defined by the health plan terms and conditions in the certificate of coverage. So it's kind of like preventive maintenance for yourself, right? If you've got a car or other things that you routinely do preventive maintenance on, this is doing preventive maintenance on your own health, and hopefully you don't have anything that's a concern. But by going in for your annual preventive checkup, if something is coming up, hopefully you can catch it early and have it addressed, and so it's going to have a better outcome for you down the road. So the preventive services are categorized by adult, women, and children, and are of no cost to the member. Again, if you go to the Common Ground website, we've got a very robust list of those services that are considered preventive and no cost to you. So if you want to look at that, again, go to the Common Ground website. So otherwise, you could contact our member services area, and we'll touch base on that contact information later. So some of the examples are mammograms, TB screening, flu shots. There's a handful of other immunizations that are also included as preventive, such as a tetanus shot, a colonoscopy, or birth control. All of these and many more types of services are at no cost and preventive to you. So, definitely get up to speed on what those are and take advantage of those while your policy is enforced with Common Ground. So let's touch on your annual wellness visit, which we highly recommend, okay? So when you go into your primary care doctor for your annual wellness visit, you're generally there to receive preventive services that your expectation is they're going to be at zero cost to you. Now, if during that conversation with your doctor, you mention any diagnostic related concerns, they may then put that in their notes. They may send that service, a diagnostic service, to us to process, and you may receive a bill because it's something they provided that was other than a preventive care service. So what are some of the things that you can do to avoid surprise charges? Well, first, make it clear when you schedule your visit that you want to be informed if you are offered services that are not preventive, no-cost care, okay? When you're there, remind your provider at the time of the visit, you don't want any services that are not preventive, no-cost care. Be aware of that if you discuss any specific health concerns with your doctor that require additional tests, neither the visit nor the test may be billed as preventive. So let's say you go in for your annual no-cost preventive care. And while you're there, you start a discussion with your doctor and say, you know what, my right knee's really been bothering me. And he or she takes a look at it and says, you know what, we're going to send you down the hall for some x-rays. Well, that has now come from a preventive visit to a diagnostic because they are providing additional service to you that they are going to bill as diagnostic. So just be aware of, what is required to, keep that a totally preventive visit for you at a no-cost basis. So prior authorization. There are some services that are covered services, but they require prior authorization. So what that is, it's an advanced, written, and authorized response for specific medical services, treatments, or prescriptions. So a prior authorization must be submitted by an in-network doctor. It can be a primary care doctor, it can be a specialist. But it really is your responsibility to ensure that it's been received and approved prior to services being rendered. So example of services that require prior authorization. Surgery, okay. All right, you got a knee or a hip issue and your doctor's recommending you have surgery. Well, that's one of the things that requires prior authorization. They have to call us or write us, and they have to get written authorization that that procedure is covered and they can perform that procedure. Scans such as MRIs, specialty medications. I mean, there are some medications that are in the formulary, they're covered, but they're high level, they're specialty medications, and they need to get prior authorization for them to be filled for you. Insulin pumps, skilled nursing facilities, and things such as transplants, okay? Usually when you're looking at any of these on here, these are usually more expensive, high ticket items. And so, you know, those do require prior authorization, and that needs to be requested by your physician. Let's touch on what a formulary is. So what it is it's the plan's list of covered prescription drugs, and we call it a formulary. And again, this is something that is available on our website at Common Ground. It's called a formulary reference guide. It's a very handy tool. I mean, I know I use it all the time when folks are calling in, and I know a lot of members themselves will go to our website and check it out, or they'll touch base with our member services area to make sure a certain drug is covered, and if it is, you know, what tier level it is. So what the formulary is doing is it's listing the covered medications or prescription drugs. It provides information as what tier level the medication falls into, along with any additional information or requirements. So if you went to the formulary, and this is kind of a snapshot of some of the things you're going to see, but there are a handful of drug tiers. So tier CM, that's really for oral chemotherapy medications, okay? And that'll be noted next to the name of that medication that's covered in the formulary list. Or a medication can be tier 1 or generic, tier 2 or preferred, tier 3, which is non-preferred, or tier 4, which is a specialty medication. And when you look at the dollar sign next to each of them, it kind of tells you that as you kind of go up in the levels, that's a more expensive medication, okay? Another thing you may see next to a covered medication in the formulary are notes. So if you see an M next to a medication in kind of the comment or remark category, that's an authorized generic or co-branded product. PA means prior authorization, okay? That's probably going to be a more expensive medication, and your doctor is going to be required to give OptumRx more information to determine coverage. So OptumRx is the pharmacy benefit management company that Common Ground uses to help process through prescription medications. That their contact information is actually on the back of your insurance ID card. So if you ever have to contact them for anything, just be aware OptumRx's contact information is on the back of your ID card if you have any questions or you're in a authorization situation. Preventive drugs. These may be covered and with no co-payments when healthcare reform requirements are met. PD or preventive drugs. They're available at $0, again, if healthcare reform copay waiver is approved. Quantity limit. Medications may be limited to a certain quantity. So you may be on a medication, you may just be starting on it, or you've been on it for quite a while. And you just know that, you know, every time you go and pick it up, you're only going to get a 30-day supply or a 90-day supply. So if that medication has a quantity limit, that'll be noted in the formulary. And step therapy, that's basically medication where other medications, other lower cost medications must have been tried before the higher cost medication can be covered. So you may have a situation where you've been receiving treatment for a certain condition, you've tried drug A, you've tried drug B and C. Those are all recommended medications for your particular situation, and they may not have worked or not have worked very effectively. And so the next step is the more expensive medication. And so, you know, Optum's going to want to see that, hey, your doctor tried A, B, or C, or whatever the protocol is before authorizing that special medication. So just be aware of that. And our formulary is located on the website at cgcares.org under prescription coverage. So again, if you've gone out there or you haven't, it's a really nice resource, provides a lot of information in detail. And again, if you have any questions, you can contact Optum, or you can contact our member services team at Common Ground. So we're going to talk about coverage and benefits, touch on the EPO network and what that means, review our service area, and some of the benefits. So EPO network, that means Exclusive Provider Organization Network. So as a member, you must receive care from an in-network provider. By doing so, we're able to offer the most affordable provider rates because we are contracted with those providers. There are limits for any service they provide that's a covered service as to what they can charge, and that helps us price the plans and keeps the premiums as affordable as possible. So emergency and urgent care services are covered by out-of-network and in-network providers, okay? Members do not have to indicate a primary care physician or get a referral to see an in-network specialist. So if you want to go see, a primary care doctor, you don't have to tell us who he or she is. You just need to make sure that they are in network. They can be 5 minutes from your house. They can be 30 minutes away. But you just need to make sure they're in network and obviously, schedule an appointment to go see them. If it's a primary care doctor, let's say you have a situation where you have to go see an orthopedic doctor. Again, you don't have to let us know who that person is. You just need to make sure that he or she is in network and then schedule your appointment with them, okay? There are some situations where services may be requested on the network. Maybe you have a situation, maybe you're going to Aurora or Bellin or Theta Care or Door County Memorial or Medical Center, and your situation is that they just cannot help you. You need to see somebody that maybe is a specialist that's out of network. In that situation, your primary care doctor has to provide a written referral to go see an out-of-network provider. And we're going to review it. And if there is somebody in network that can provide that service that maybe your primary care doc or that other specialist isn't aware of, we're going to recommend that doctor for you to go see. If for some reason there is no one in network that can provide the specific type of treatments or service you need, we're going to authorize you to go see that provider. Maybe they're at UW-Madison, maybe they're at a hospital down in Illinois or wherever. And we will provide a written confirmation that you can go see this particular doctor for this condition or conditions, this type of treatment, and for this time span. So just be aware of that. If there is an out-of-network situation, that you do have to go through that prior authorization process to get that referral. Let's talk about our service area. So we have plans in 2021 in 22 counties. Let's start up north at Florence, and we work our way all along the east coast of Wisconsin down to Kenosha. So when you look at the map, everything's like kind of 1 or 2 or 3 counties in from the western shore of Lake Michigan. And again, if you lived in Oconto, or you lived in Winnebago, or you lived in Milwaukee, obviously you can go see an in-network doctor or go to a facility there locally. But if some reason, you live in Oconto and the doctor you need to see is at Aurora St. Luke's in Milwaukee, you can go down to Milwaukee and see that doctor. And if he and she is in network, which they will be, that is an in-network visit. And so that's going to run through your plan the way the plans are designed to be. So you can either go locally, which obviously a lot of people prefer, but sometimes there's a situation where you may have to kind of make a trek and see a doctor in another county in the service area to get your particular medical condition addressed. So 2 of those counties for 2021 are new in Wisconsin. One is Florence, which is way up north of Marinette. And the other is Green Lake, which is the next county west and adjacent to Fond du Lac. So 22 counties for us in 2021. So let's take a look at which healthcare systems are in the provider network. I would say we have a very robust provider network. There's Aurora Healthcare, Theta Care, Bellin Health, Children's Wisconsin. There's locations in Wauwatosa in the Indianapolis area. Door County Medical Center, that's up in Sturgeon Bay. Dickinson County Healthcare System. They're actually based in Michigan, but they do provide services to a lot of folks that might live in Florence or Marinette. So, you know, if we live down here in Southeast Wisconsin, that might not be a system you're familiar with or that you would go to, but, you know, people in the northern part of our service area, you know, that might be an outlet that would be advantageous to them. And also we have St. Joseph Hospital in Milwaukee. It's the St. Joseph Hospital campus only, okay? So be aware of that. Again, a very extensive healthcare system with many of the top healthcare providers in the state of Wisconsin. Pharmacy network. Again, most of the major pharmacies are in the network. So if you have a prescription drug medication that you need to go be filled, you can go to Walmart or Costco or ThedaCare or Bellin or Walgreens or Aurora, CVS, Skywalk. All the major pharmacies are in network. And also if you go to our website, you'll see a Wisconsin state listing. So, you know, obviously these are the more well-known pharmacies in the state, but we also have a lot of smaller, sometimes privately owned pharmacies, especially important if maybe you're more of in a rural area. And so there's a very extensive list of our statewide pharmacy, again, on the website. And again, if you're not comfortable with going on a website and looking for the information, our member services team can be contacted and they can assist you to find somebody close to you if maybe you're not near one of these larger type pharmacy organizations. So emergency and urgent care, let's touch on this a little bit. So if you are seen by an out-of-network provider, services will not be covered unless it's emergency care or urgent care, okay? So on emergency care, you are covered in or outside of our 22 county service area. So examples of this are going to be, you're having severe abdominal or chest pain, severe burns, serious head injuries, stroke symptoms, or heart attack symptoms. I mean, these are situations you're going to want to go to in emergency care. So if it's local, if it's in network, that's great. But if you're, let's say, traveling to Madison, you're out of state and you've got to go to an ER, that is going to be something that is covered on the plan when you're out of network. Also, urgent care is covered on the plans. But if it's urgent care, it's only going to be covered on the plan if it's provided outside of our 22 county service area. So if you need urgent care and you live up in Florence, or you live in Fond du Lac, or you live in Kenosha, you need to go to an in-network urgent care in your service area, okay? But again, if you happen to be traveling to, let's say, Madison, you're out of state, and you go to an urgent care outside of our 22 county service area, that map that we just reviewed, then that's going to be covered under the plan benefits. So just kind of keep those things in mind as to how emergency care and urgent care are looked at under your plan of coverage. I think one really nice benefit that we have on all of our plans is something called Virtuel, okay? So what is Virtuel? It's a 24/7 online clinic. It's available on all of our plans. It's part of all of the plans, all right? So it doesn't replace emergency care or urgent care or going to see your primary care doc or a specialist. But if you have a situation where, let's say, something comes up in the evening or the weekend, or you're traveling to another part of the state, or you're out of state, and you've got something that comes up that, hey, you at least want to bounce off a medical professional to see what he or she says and to see if what kind of treatment's recommended and to see if you need any medications to kind of address it in the short term. So you would go to virtuel.com on your smartphone, on a laptop, on a computer, and it's kind of like going to your primary care doctor in a way, but you're doing it virtually, okay? So you're going to answer a series of questions, you know, obviously your name, other personal information. There's categories as kind of where you go into and answer questions. And then you submit that. And within 30 minutes, you're going to get a response back from a board certified nurse practitioner, okay? And they're going to say, okay, here's what we think you have. Here's our recommended plan of care. If you need prescription drugs, they can wire that over to, again, a Walgreens or a CVS or any other type of in-network pharmacy. It's available anywhere 24/7. And one of the nice things about it, it's very convenient, it's flexible, and if you have a plan other than an HSA compatible plan, which most plans are, the first 10 e-visits in the calendar year are free, okay? So most of you could have 10 free e-visits through Virtual in a calendar year to get consultation. If that works out better for you because of your location, your travel, your schedules, or when something comes up. It's just a really nice service that's part of all the plans. If you happen to have an HSA compatible plan, the way the plans are designed and because of the requirements on the plan design, each time you would use Virtual for an e-visit, there would be a $49 charge until you hit your deductible / out-of-pocket max. So if you're not aware of Virtual, kind of make note of this. And I know it's a lot of employees at Common Ground have used it. I've talked to a lot of members and agents that have clients that have used it and get very, very good responses as to being able to access that and the services provided. So keep Virtual in mind. Thank you. So one of the new features we have on our plans in 2021 is a $15 insulin benefit, okay? This is available on plans other than bronze and catastrophic plans, okay? So what, we realize that in Wisconsin and nationally, diabetes is an issue that's impacting a lot of people and families. So we wanted to help remove some of the barriers and create a relief for our members. And one of the barriers is that anybody that is on insulin or uses insulin products, themselves or a family member, they know that over the past few years, the cost of that service has risen dramatically. And it's become a dire situation for some people as far as the affordability of getting those products. So on the silver and gold plans, all formulary tier 2 insulin products, there's a $15 copay for a 30-day supply, and this applies before your deductible, okay? So a really nice benefit that's available on all the silver and gold plans from Common Ground in 2021. So let's touch on some of the contacts and resources that you have available through Common Ground. I'm going to touch on a doctor versus carrier. Contact information and how to get involved at Common Ground. So what's the distinction between the doctor and the health insurance carrier? So your doctor and your health insurance company, Common Ground, we play two very different roles in your health care. So it's really important that you know who to talk to about and how best to manage your health plan so it works most affordably and effectively for you. So, some of the things that you're going to have conversations with at your doctor or your doctor's office, obviously, are your health concerns. Medical advice from your doctor, whether it's a primary care doctor or specialist. Your provider bills and the charges that they require you to pay toward them. Scheduling a doctor visit or getting a prescription filled. So these are some of the things that you would definitely have a conversation with your provider. The health insurance carrier, Common Ground. So your provider, if you have a service that is going to be scheduled that requires prior, your provider has to contact Common Ground to get that prior authorization to perform that service for you. If you need to know what doctors are in your network, again, you can go to our website. But if again, you're not comfortable with that, you can call our member services team and they can help you find a primary care or a specialist doctor in your area that you can go see that's in network. You can contact us to see if a service is covered, okay? Obviously, a very robust list of things that are covered with Common Ground. So if you have any questions, definitely contact us and we can help you out with that. If you have questions about your plan, how your deductible works, how your coinsurance works, how the co-pays work, definitely contact us and we'll help you out. So plan administration, let's take space in there really quick. So there are two different ways that you can apply for insurance with Common Ground. One is on the exchange or healthcare.gov or the marketplace or through Obamacare, all right? So if you need to make any changes to your account, where your application originates and how you enroll depends upon how you make any adjustments or changes to your account, okay? And these changes might include terminating your policy, adding or removing a dependent, updating your income. If you have an application through healthcare.gov, if you come direct to Common Ground, we don't ask anything about income or family size, or updating demographic information. Can you go back to the last prior slide, Kate? So if you're enrolled on the marketplace, any of those changes to your application, to your profile, have to be done through the marketplace. You can call 800-318-2596, or you can go online to healthcare.gov. I know a lot of folks that have applications that start on the marketplace. They've done it on their own. If you work through an agent or a broker, again, he or she can help you with that process of getting things updated on your application, with you obviously giving them the authorization to help you to do so. If you're enrolled directly with Common Ground, which is off the exchange, what you would want to do is just call us directly. Our member services line is 877-514-2442. That team is a very experienced team. They're a very good crew. They're available from 8 a.m. to 5 p.m. During the week. Or you can go to our member portal at cgcares.org. Or if you want to email us, you can send an email request to the member services team at info@commongroundhealthcare.org. So just kind of keep aware of the differentiation between where you need to go to things adjusted, whether or not you're on the marketplace or direct with Common Ground. Thank you. So Common Ground contacts and resources. Okay, our member services team that I just mentioned. So again, that number is 877-514-2442. So they can help you if you have any questions regarding benefits, billing or claims questions, assistance with your health or billing portal, or if you're looking for information on an EPO referral or out-of-network referral or medical prior authorization status. Now, if you go to the Common Ground website, that web address is cgcares.org. And so if you're looking for a provider, you can go out to that website and you can find a doctor. You can look and review the certificate of coverage. Again, that's available to you, as a member or, prior to when you were shopping for insurance. That's all out there for folks to see. If you want to access your health or to view claims information, you can also go to the website. And if you want to access your billing portal, to pay your premium and view plan information, you can also do so through the website. So a lot of information out there. We try to provide as much information and as much clarity as possible to help you, while you have coverage with us, and again, make it a more informed decision and effectively use your coverage. OptumRx, again, that's the pharmacy benefit management company that kind of coordinates all the prescription drug medication that flows through your plan. You can call them at 855-577-6545. That number is on the back of your insurance ID card. And online, you can reach them at optumrx.com. So why would you want to call Optum? Maybe you have prescription questions. Maybe you want to check on your prescription prior authorization status because your doctor is recommending that you go on a medication that requires prior authorization. Or if you want to set up mail order prescriptions, there are many prescriptions or medications that you can do through mail order, and that might be a more cost-effective route for you to go rather than picking them up or having them sent from the pharmacy. So those are the key contact areas that that will be helpful for you to get additional information on your Common Ground plan. So the Common Ground website, again, that's cgcares.org. So if you go to our website, kind of the top of the page, you're going to see kind of there's going to be our member services number. You can go into your health portal to pay your premium, or you can click on Find a Doctor. So you can do a lot of things on the website. Again, if you're comfortable utilizing websites and getting information or doing transactions, you can make payments. You can print yourself an ID card. You can review your claims. You can find a doctor. You can look up prescriptions. As I mentioned before, you can review the individual certificate. So there's a wealth of information out there that you can access just by, again, going to our website. Again, a lot of these things, you can also contact our member services team to assist you if that's a better route for you to go. So find a doctor. At the top of that front page, that home page of the website, there's a Find a Doctor button. So this is the way that, if you're new to Common Ground, or you've been with us for a year or a couple of years, and you need to find a doctor that for a specific situation or condition that you haven't seen before, and you want to make sure he or she is in network, you can go to our search function for Find a Doctor. So if you click on that button at the top of the page, what's going to come up is kind of a search process. So it's going to ask you what type of provider that you're looking for. So you're saying, okay, I want to find a physician. So you kind of click on that drop down arrow and you put in physician. Let's say you're living in Racine, okay? So we're going to ask for your zip code. So you put in your zip code 53406. Provider organization name, you're not really sure, so you can leave that blank. But you've got to go see a dermatologist, okay? So again, the specialty, there's a laundry list of specialists in that category. You click on the drop-down box, you kind of scroll down and you click on specialist. So the way the search is set originally, it's going to show you dermatologists in network in your zip code area within a 5-mile radius, okay? Now on the advanced search, you can do things such as, okay, I'm going to go see a dermatologist, but I prefer to see a female doctor rather than a male. You can request that list to be female only or male only doctors. If you want to stretch out the radius to 10 or 15 or 20 or 50 miles, you can do that too. So there are ways that you can kind of customize that search by going to the advanced search. So this is just an example of, okay, these are the 5 dermatologists within 5 miles of your current zip code. But again, on the advanced search, you can get a lot more detail if you want to kind of dive into it a little deeper. So really, really great tool on the website. Payment options. There are various ways that you can pay your premium. You could do an online payment on the website. I mean, you would have to go out there. You would have to initially set up your account with Common Ground. But once you're there, you sign in. You can pay by a bank account or a credit or debit card. The current credit cards that we use accept are Visa, MasterCard, and Discover Card, okay? You can also set up recurring payments. So if you want to pay, if you want to like auto pay or recurring payment to come out of a bank account or one of those credit cards on a monthly basis, you can set up recurring payment. It can be on or between the 15th and the 25th of the month. A lot of folks pick the 15th and 25th, but if you wanted the 20th, you could say on the 20th of every month, I want whatever my premium amount is to be charged to my Visa or MasterCard. Okay, so a very convenient thing if you want to just tee that up and have that recurring payment come out on a monthly basis. All right. One quick note: regardless of how you pay, whether it's one-time payment, whether you send in a check, whether you're on recurring payment, you're always going to get a paper invoice from us every month and we strongly advise that you open it up and read it to make sure that everything's kind of clicking along the way it should be. You're being billed correctly. If you're on recurring payment or auto pay, the correct amount is being taken out, and things of that nature, okay? You can also pay by mail. Some people prefer to send in a check. Bank card authorizations, money orders. If you do so, you're going to send it to Common Ground Healthcare Cooperative at box 78553, Milwaukee, Wisconsin 53278-8553. If you have your invoice and payment stub, include that in there. If for some reason you don't, strongly recommend that you put your member or subscriber number on the front of that document or payment document when you send it in, because this mailing address does not come to our office in Brookfield. It goes directly to the bank. And so, if that account number is on there, they match it up with the premium amount, and that makes sure that that money gets properly credited to your account. There's also a drop box. So, some people actually do come to our Brookfield office and drop off their payments. So they can drop off cash or a check or a money order or an electronic payment slip. We'll provide postage paid envelopes. There's credit and debit and authorization forms that we provide. And our office location is 120 Bishop's Way, Suite 150, Brookfield, Wisconsin, 53005. And we get this question a lot, so I want to make this make everybody aware of that we cannot accept payments by phone. So it either has to be one-time payments online, recurring payments online, sending in payment documents to the bank, or dropping it off at our Brookfield office. So getting involved in Common Ground. We have, and again, this is kind of unique, I think, for a lot of insurance companies, that we have a member advisory committee. So, we really value your opinions, and we believe that as we set the direction for the organization, not only the executive team, but the board of directors, that it's very important that we listen to our members, so you can have a voice in your healthcare coverage. So one of the things you can do if you're interested is to volunteer for our member advisory committee. So it's a forum where your voice will be heard. You can provide feedback about services, plans, and more. You can help us shape policies in the future. As a group, we meet just 4 times a year. And if you're interested, you can send your resume and contact information to membermail@commongroundhealthcare.org to learn more. And then we'll reach out and provide more information. And, if you're interested and you feel that that's something you'd really like to get involved in, by all means, jump in and become part of the advisory committee. The other thing that I want to make you aware of is that, again, I mentioned we have a board of directors. Every May, we have an election to elect that board of directors. And again, if you're a member with Common Ground, whether an individual or you're a business owner that has group health insurance with us, and there's an open spot on that board, you can run to be a member of our board and get even more involved in the process. So just wanted to make sure that you're aware of that. So questions in the gift card drawing. I think Katie's going to handle the gift card drawing, but if you have a specific question regarding your personal medical needs, we ask that you call our services team at 877-514-2442 or email us at info@commongroundhealthcare.org with the subject line Insurance 101 for assistance. And again, if you'd like somebody to give you a call back, please specifically note that in the request and let us know what a good date and time frame is for us to get on back to you. And our member services team will get on back to you and address your specific question or questions in a very prompt fashion. So want to thank everybody for their time. Katie, are we going to have questions that come up as far as being able to answer them?
Yeah, so before we jump into doing a Q&A, we're going to do the gift card drawing. Just for those who don't want to stick around for the Q&A, we can get that out of the way.
Okay,
So
great.
I have everybody assigned a number, so I'm just going to do a random number generator, and then I'll show to see who won. So let's see what the number is. All right, lucky number is 26. So I'm just going to show to see who is number 26. Okay, so it looks like Robert Stevens is the winner. So congrats, Robert. If you could just stick around for just a moment so I can send you a message and make sure we have the correct information to get that sent out to you. But congratulations, Robert. That's just a little token of our appreciation for joining us today for our Insurance 101 meeting. So just give me one moment. I'm going to send that out, and then we are going to jump into the Q&A. All right, so let's get started with the Q&A then. We do have Jim Wood, who just presented. He's one of our account executives in the sales department. We also have two of our member service representatives. We have Nicole and Patty, and then we also have Deb Trinan, who is our sales director. So we're going to get started with the questions. And the first question is, when scheduling an elective procedure, what's the best way to ensure that they go to a in-network doctor, or just to make sure that there's no out-of-network doctors that are involved in that procedure?
So Katie, are we having folks from member services answer that, or does anybody jump in?
Anybody can jump in. That might be more of a question for one of the member services reps. So if Nicole or Patty want to take that one.
Good morning. Good morning. This is Nicole. All right. So when scheduling an elective procedure, what's the best way to ensure that there's no out-of-network providers that participate? That is something that you strongly want to talk with your provider who is wanting you to have the procedure done. Typically, if you are having it done with an in-network facility, for example, with Aurora, all of Aurora is in the network. There really is no way to determine who specifically will all be participating within a procedure. As while you're having the procedure, there may be doctors that they do call in while you're not aware of it. So if it's done within Aurora, typically that will be covered and applied to your plan benefits.
Thank you, Nicole. So hopefully that answers everything. So let's jump into the next question then. Let's see. So they want to know if a colonoscopy is considered a preventative service if it is less than 10 years since they had their last one.
Sure. So this is Patty from Member Services. For a colonoscopy, it would be considered preventative as long as there's no prior history. So if you've had the screening in the past and they did find some results, if there is some prior history, then it would be considered a diagnostic screening, and then it would apply to your deductible or co-insurance. So as long as there's no prior history, then it is covered at 100% as preventative.
Thank you, Patty. So the next question then is the COVID-19 vaccine at no cost? So I can answer this because I know we got this at the last one. The best way to get updated information on anything COVID related is if you go to our website, the very first thing, it's going to have a link to go to information related to COVID. So we'll always send stuff out to you, but if there's anything specific that you want to know, you can always go to that link on our website. So the COVID vaccine is at no cost. You don't need a prescription or anything to get it, but they're gonna do kind of some sorting out of when you're able to receive it. And if you go to that link on our website, there's actually a question that says, when can I receive the vaccine? And it has a link there to help you out. Right now, they're doing just health personnel, but eventually it will be available to the public. And once it is, it'll be at no cost, and you do not need a prescription, and you can actually get it anywhere. So hopefully that answers that. So the next question then is, if they have blood work done at their annual doctor visit, would that be considered a no-cost preventative service?
Okay, so this is Nicole again with Member Services. In regards to the preventative lab work, so with your preventative screening, the lab work that is covered in full is the blood glucose and the cholesterol. All other labs are subject to deductible co-insurance. There's also a really helpful tool on our website at commongroundhealthcare.org. If you go under the member section and go to the preventative services page, that will list the complete listing of preventative services. But as far as pertaining to the lab work, it is the blood glucose and the cholesterol that are that is no cost to the member.
Thank you, Nicole. So next question then is, this is geared more towards sales. So if Jim or Deb want to take this one, and they kind of just want an explanation of why our service area is only on the eastern side of Wisconsin, and if there would be any potential that we would add UW Health in our network.
Yeah, this is Jim. I'll answer that. I mean, in 2020, we had 20 counties. This year, we have 22. So, you know, every year, the management team, the board of directors, they take a look at, you know, kind of, they take a look at our service area and what's working for us. How as an organization can we be most effective? So, as we currently look at the map of Wisconsin, for us, the most effective way that we can provide health insurance and for the betterment of our members is to stay in the 22 counties that we currently have. And it has to do with market forces such as other healthcare systems, other products, and a wide variety of things. So we do take a pretty deep dive every year as to, okay, we're at 22 counties now in 2021. And as the management team starts their planning, and I know they're already planning for next year in the short term and years beyond that, you know, we're taking a look at, are there other areas that we can have a presence where there is a need for another carrier, where we can have plans that are a good plan at affordable prices and be competitive in that marketplace. And so if we aren't in a market, it's because there's a factor or a multitude of factors as to why, as an organization, we believe that we're just not going to be an effective player in that market, so we don't expand out to, let's say, a Madison or a La Crosse or a Wausau. So I hope that answers it for you. Deb, do you want to comment at all?
No.
Okay.
Jim, I think you covered it pretty well. I'm sorry,
Okay.
I couldn't get off mute. But yes, it really has to do with, you know, contracting and other systems, and whether they want to contract with us. And we do have a network development area that is always looking at what are those opportunities.
Okay, thanks, Deb.
Awesome, thank you. So next question then is, if they haven't met their deductible, do they still have to pay a copay when picking up a prescription?
Yeah, I'll answer that. Again, you know, many of our plans do have copays for medications, others don't. So if you have a copay, let's say it's $10 or $20 for a generic or a tier 2 medication, if you go pick up your generic medication at Walgreens and you've got a $10 copay, you pay the $10 copay. You do not have to have had your deductible met. Now that copay amount doesn't go towards your deductible, but it goes toward your out-of-pocket net. So let's say you start a plan with us in January, and you're going in and paying a copay to see us, a primary care doctor. You're paying a copay to see a specialist. You're getting some things that are preventive, no cost, but other things are diagnostic, and so they're sending in their services as coded as diagnostic, and so we're applying that toward your deductible or coinsurance. Anything out of pocket that is done in network and a covered services, that money that you pay out of pocket all aggregates or rolls up through the year towards your out of pocket max. So you could be paying money towards your deductible, some towards your coinsurance, some toward copays to go see doctors or prescription medications. All that kind of goes into the same pot, if you will. And once you hit that out of pocket max, then going forward, for those in-network covered services, Common Ground is paying at 100%. So every dollar you spend out of pocket that's in-network and covered services, you're getting credit on that toward utilization on your plan.
Thanks, Jim. So next question then is, I think this is in regards to Virtual with the HSA plan. If you could correct me if I'm wrong from the question, but I believe they want to know why HSA plans don't get those 10 free visits for Virtual. Why is it different with HSA?
Okay, I'll address that. So HSA plans have a specific plan design format. That's a requirement for any company that's offering an HSA compatible plan. And generally, they're considered high deductible plans. And one of the specific things is on an HSA plan, if you have an HSA plan, HSA plan on the individual side, you're going to see that they're not going to have any co-pays to see doctors. They're not going to have any co-pays to see pick up prescriptions. They're basically set up that your deductible and your out-of-pocket net the same amount. It could be $7,000, it could be $8,550. But the way the plans are set up to be HSA compatible is that the plan cannot pay out benefits on your behalf until you've met your deductible / out-of-pocket max. And as a result, if the plan does not have a copay, we can't force a copay in there for the insulin benefit.
All right, thanks, Jim. So let's see. Next question then is, one second, let me just bring it back up. Okay, so it's in regards to copays. So so they basically want to know if they went to ThedaCare's walk-in clinic, urgent care, fast care, or a to see their primary care physician, would that be towards a copay? Would they pay that with a copay?
Hi there, it's Patty from Member Services. For that, it would depend on your plan. Some plans have co-pays for certain services. Some plans, it just applies to your deductible or co-insurance. And the co-pays can be different from plan to plan too. So it would depend on your plan details specifically.
Thanks, Patty. So then the next question, I don't know if we specifically know this one, but maybe Patty or Nicole have had to look this up before, but is Victoza included in that $15 copay insulin benefit? Is that one of the tier 2 drugs?
Yep, I just checked actually that Victoza is a tier 2, and it looks like for the 2021 schedule of benefits, tier 2 insulin discount is that $15 copay.
Okay, perfect. So yes, it is then. So next question then is, if they are hospitalized and they're hospitalized at a out of service area hospital, how would that be covered? Nicole, do you maybe want to take that one?
Yep, sorry, I was trying to unmute.
That's
I'm
okay.
so sorry. Okay, so we're referring to emergency out of network
Yes, I believe so, yeah.
Okay. So if you have an emergency and you do go to a hospital or facility that's out of network for the emergency room, the providers will submit those claims to Common Ground, and we will process those as in-network, and it will apply towards your plan benefits. However, with the emergency services, typically, once a claim is processed as in-network, you will see on your explanation of benefits on the comments that if the provider or facility is not satisfied with the way that the claim processed or paid out, what they can do is potentially bill you as the patient for the remaining balance. So you will see that, but all emergency is processed as in-network when the claim comes in.
Thanks, Nicole. So next question then is, if they are a Common Ground member, can they get assistance with making their monthly premium payments?
Yeah, this is Jim. From an assistance standpoint, I mean, I would say the majority of members of Common Ground actually do go through healthcare.gov or the marketplace. And also the majority of those folks also get some type of a tax credit. Not all, but I would say the majority. And so if I'm reading this right, when I look at assistance with the insurance payment, if you go through healthcare.gov in the marketplace and you qualify for a tax credit or a subsidy, and you know what the amount is, whether it's $100 or $200 or $300 a month, that is the tax credit or the assistance you get to help make that premium lower and hopefully for many folks much more affordable in order to get into and keep a health insurance policy in force.
Thanks, Jim. And then, so yeah, I guess that question can kind of be taken two ways. If you are referring just to, in general, how to make a payment, you can call into our member services team and they can walk you through that too, if that's what your question was referring to.
Great.
So next question then is, if they are, if they're a Common Ground member, but they purchase through the marketplace, will they still have access to the website? I'm assuming our website to pay bills, basically through their account, or do they have to go through the marketplace to pay their monthly premium?
Yeah, that's actually a very good question. So, if you apply through healthcare.gov or the marketplace, I mean, again, obviously you're gonna pick your plan, find out whether or not you get a tax credit, and if so, what it is. And then once all is said and done on that end, what they do is they send us an electronic file, and then we set up your policy profile on our end. And from that point going forward, we send you out invoices, you send your premiums to us, we process your claims, we do pretty much all the communications going forward with you. So whether you're on the marketplace or you're direct with Common Ground, anybody can access our website. If you want to set up your personal health portal or a premium payment portal, if you want to make a one-time payment online or set up a recurring payment, anybody that's a member has access to the same website information access and services across the board. So good question.
Thanks, Jim. Next question then is, can they pay for more than 1 month at a time? So if they want to pay for the whole year, half the year, etc.
Okay, another really good question. The answer is yes. Yes, you can pay going forward. You can pay for a couple months at a time. You can pay for the whole year if you want on this condition. The only way we can accept that payment at this point is by check, okay? So if you've got a nominal premium and you say, you know what, I just want to write one check to Common Ground, I want to be one and done, you can send us a check. Whatever that dollar amount is, you just kind of calculate out what it's going to be for 12 months and you send it in. Now, in saying that, what's going to happen then is that you're going to get invoiced every month. And so when that 12 months worth of premium comes in, let's say it came in January, we're going to pull whatever your premium for January is off of that amount. And then the remainder is going to be sitting on your account as a credit. So when you get your February invoice, it's going to say, okay, we took $50 out for February, just for an example. And now your credit is $50 less. So every month you're going to get an invoice from us. And every month you're going to see that you don't have to pay us anything and you've got a credit on your account. But every month we're going to tick $50 off of that balance. And then the last amount at the end of the year is going to be applied toward December, and then that pays up your plan through the year. Now, as I said before, you're going to get a paper invoice every month, and we highly recommend that you open it and take a look at it. And the reason I say that is that if you have a plan through the marketplace and you're getting a tax credit, there are times that the marketplace may make adjustments to your premium. They may increase, they may decrease your tax credit. Sometimes if they're looking for financial information, if they have questions, they won't terminate your coverage, but they may pull your tax credit. So if you thought you were paid through the end of December and something comes up that dollar amount now changes and increases, you've got to be aware of that, and you've got to address that and take that into account if any additional premium is needed.
Thank you, Jim. Next question then is, are any dental services covered?
So this is Patty from Member Services. With the policies, there are no vision or dental, benefits. The only dental benefit would really be if you had like a car accident where there was some really bad damage, but there are no dental or vision benefits.
Thanks, Patty. Then the next question then is, so if they previously had any polyps, would their next colonoscopy be considered preventative?
This is Nicole with Member Services. So if you have previous detection of polyps, all of your colonoscopies going forward would then be considered diagnostic and apply towards deductible coinsurance.
Thanks, Nicole. Then the next question we might have answered, but we'll just go over it again. So if they're insured through the marketplace, so if they purchase their Common Ground plan through the marketplace, do they pay the premium through healthcare.gov? And no, you would pay it through Common Ground. So next question then is, if they have an annual preventative visit with their doctor, but choose to have a pap/pelvic with their OBGYN, will that be covered as preventative care despite being with a different doctor?
Okay, so this is Nicole with Member Services. If I'm understanding the question correctly, you went to your yearly with your primary care physician, and now you're having your annual PAP with your OBGYN. Your women's wellness, your PAP will still be covered as a preventative service yearly.
Thanks, Nicole. So next question then is, why would I go off exchange for insurance? So why would they want to go directly through Common Ground, and what advantages are there with being a direct member with Common Ground?
Yeah, I would say the primary advantage is that there are folks that because of their income, if they apply through the marketplace, they're not going to qualify for a tax credit. So the premium for the plan would be the same. So they decide they go direct with Common Ground, and they kind of bypass the marketplace. So they're just going to apply directly with Common Ground. Either they apply directly, or they're working with a broker that applies directly. And they just kind of know from the get-go that they're not going to qualify for a tax credit. So, you know, maybe they don't want to go through the process of filling out the application on the marketplace, and it just might just be quicker and simpler for them to come direct. And so, in those situations where you know, you're pretty sure from the get-go you're not going to qualify for a tax credit, that's why members come direct with Common Ground. But in saying that, what you have to keep in mind is that if you apply through the marketplace or you apply direct, that's where your coverage or your application stays for the remainder of the year. Okay, so if your income is such that, hey, in January I just know that I'm not going to get a tax credit, and you apply direct, and let's say something changes because of the COVID situation, because of the economy, you know, maybe it's 2 of you in a family, you know, maybe you know, one of you gets reduced hours or loses your job, and your income is impacted, and your new income going forward now is such that had you gone through the marketplace, you could have qualified for a tax credit. Okay, but if you came direct with Common Ground, you're kind of locked into the direct platform for the remainder of the year. Whereas had you gone through the marketplace, even though you started with no tax credit, and then during the year, you know, something impacted your income such that now you could submit a change of income to the marketplace, and they could do a recalculation and say, hey, now you're eligible for a tax credit, here it is. And then going forward from that point on, you would get the benefit of that tax credit. So, you know, usually it's individuals that they kind of know from the get-go that they're just not going to qualify for a tax credit. So, you know, they don't go through the marketplace, they just come directly to the company. But at the end of the day, the other thing to keep in mind is that on the back end, it's whether they had gone to the marketplace or direct, if it's the same plan, it's the same plan, it's the same base premium, they have access to the same network, the same things are covered in their plan. And to the prior question, whether you're on or off the exchange, everybody has access to the website and the tools and the payment and the member portal options.
Thanks, Jim. Next question then is prostate screening for men a preventative service? Nicole or Patty, do you want to take that one?
Hi there. Yep.
Yeah.
Oh, sorry, Nicole, go ahead.
No, you can go ahead.
For that screening, that I believe that is a preventative service, again, but it falls under that, you know, it's preventative with no prior history, diagnostic, you know, so then it would apply to your plan benefits if there was a prior history.
Thanks, Patty. Then the next question then is the annual wellness visit different than the yearly physical? And if so, are those 2 different codes available to the doctor? So does the doctor have those CPT codes?
Okay, so this is Nicole in Member Services. So yes, the coding, there's actually a coding department in every provider's office. So when you make your appointments, it's very important that you let them know that this is your yearly wellness exam, so they know that you're coming in for the preventative exam only, and that's how they will code it as such to be covered in full.
Thanks, Nicole. And then the next question then is if we could just explain again what deductible and coinsurance is. And I'll go back to that slide also.
You actually advanced in one slide, Katie.
This one?
Yeah.
Okay.
So again, the deductible is if you're going in network for covered services, that's the initial out-of-pocket amount that you're paying for those services. So this Silver 4075 plan, this is a schedule of benefits. Again, every plan has one. They're available on the website. And if you received your member guide, you're going to see something similar to this in your member guide. So if we're looking at this Silver 4000 plan, your deductible, and again, the plans run from January 1st through December 31st, a calendar year. So if you're starting with us here in January and you have this plan, you have a $4,000 deductible if you're the only person on the plan. So as you go in for in-network services, obviously, Devin mentioned we have relationships with the providers in the network. There are contracted prices that they can charge for any and every covered service. So if you go in to see a doctor, you have this, that, and the other thing done. And when all is said and done and we process that, that service date, and we send you an explanation of benefits, and you're always going to get a copy of, if you went in on January 22nd, you went to see Dr. Smith, here are the things that Dr. Smith did, here are the allowed charges, here's the amount you owe the provider. So let's say it comes out to $500, okay? So that's $500 that you're paying out of pocket, and that's going toward your deductible, all right? Now, once you hit $4,000 of those out-of-pocket expenses, you've met your deductible if you have this plan and you're a single individual on the plan. So what happens going forward? Well, this plan has a out-of-pocket maximum of $8,550 for, again, in-network covered services. So as you go through the year, and every time that you go in for services, for each dollar that's allowed and charged, you're paying 25% of that expense. We're picking up the other 75, okay? And once you hit a total of $8,550, your co-insurance goes away. And then going forward, again, for those in-network covered charges, we are paying those expenses going forward. So the $4,000 is your initial out-of-pocket. Then your co-insurance is you're getting, if your plan has co-insurance on it, you're getting assistance to pay toward those expenses. In this case, it's kind of a 1-to-3 ratio. You're paying a quarter of it, we're paying the other 3/4 of it until you hit your out-of-pocket max.
Thanks, Jim. So let's go back to the last one. So we're going to need that for this next question. We had a question in regards to activating their account. If you're having any trouble activating your account, we do ask that you use the information on the screen to contact our member services team. If you want to call in, they're available Monday through Friday, 8 to 5. So if you could just contact us so that we can have somebody walk you through that. And then the second part of the question is the payment always due on the 25th, and do we offer a grace period?
Okay, I'll answer that one. Yes, on the individual plans, the 25th of the month is the date that we're requiring the payments to come in. So when you get an invoice, I think we just recently invoiced for February, okay? So when you get your invoice for February, and let's say that your premium on a monthly basis is $150, just for example, okay? So we would like that payment in by the 25th of January. Now, if the payment doesn't come in, the enrollment and billing department will obviously, we tally up all the premiums that come in for everybody. And if your premium doesn't come in, the system will say, hey, Bob's premium didn't come in. And so we're aware of that. And what happens is that you are sent a grace letter, okay? And the grace letter said, hey, it kind of looks like your payment didn't come in. Just wanted you to be aware that, that money should come in by such and such a date. Your grace period differs if your plan is direct with Common Ground or through the healthcare.gov or the exchange, okay? So if you're direct with Common Ground and you're behind on your payments, you've got 31 days to get that premium payment in. Otherwise, the full premium due. Otherwise, your plan will be terminated for partial or non-payment. So you get a grace letter, you get a little wiggle room, but you got to get that premium in and the full balance due to keep your plan in force. And the other thing to be aware of is that if come February 1 and you're not paid for February, if you go in to see a doctor or if you go to the pharmacy to pick something up and they're doing a real-time check to see if your coverage is in force, your policy is not canceled, but it's not active. So you're going to have issues picking up medications. The doctor may say, hey, you know what? They're saying your coverage isn't in force, and it's because you're in grace and you haven't paid. So it's always very important to get that payment in on a timely basis and the full amount. So now if you're through the marketplace and you don't have a tax credit, and there are some people that go through the marketplace and don't get a tax credit, that same 30-day grace period applies, okay? So if you're direct with us or through the marketplace with no tax credit, you've got a 30-day grace period, all right? Now, if you're through the marketplace and you have a tax credit, you actually have a 90-day grace period, okay? So if you don't pay for February or you pay short, you're gonna get a grace letter. If March comes and you're short, you can get a grace letter. But if you go 90 days without paying the full amount due based on that last invoice, again, your policy is going to be termed for non or partial payment. And during that time you're in grace, you are not going to have access to benefits on your plan. So always important to get that premium in on a timely basis. And if you have any questions on that, if you need assistance or direction on that, you can always call our member services team and they'll be more than happy to help you out.
Thanks, Jim. Next question then is, if they're going to get if they're at their preventative visit and they're getting their preventative blood work, so they get their cholesterol and glucose screening, but they also have to have another blood test done. Would the cholesterol and glucose test still be considered preventative, or since they're getting one that's not preventative, none of it will be preventative?
Okay, this is Nicole. Okay, so as long as so when the provider is billing your claim for the blood glucose and the cholesterol, they are going to have a diagnosis on there that that was for preventative, regardless if you're having other blood work in the lab done as well. Those two, as long as that claim has that preventative diagnosis on it, those two blood labs will be covered as preventative. And then the other ones remaining on the claim, those will apply towards deductible coinsurance.
Thanks, Nicole. And then next question then is, so do they need a referral to go see a specialist, and any tests that they ask for? So basically, do they need a referral to see a specialist? And then if they need any tests, do they have to get any like authorizations to get those tests? Or I'm sorry, if they go see a specialist, and do they need a referral to see a specialist? And then can they receive preventative services from a specialist, and it'll be of no cost? Sorry about that.
Sure, no problem. Alrighty, so this is Patty. Yep, again, you don't need any referral to see any in-network provider, specialist or otherwise, as long as they are, in network. And then for the preventative services with a specialist, I believe that can still be preventative with no cost share, even if you do see a specialist. Is that correct, Nicole?
To my understanding, which we can certainly jot this down for clarification, but to my understanding, if it is not done, if you have services done by a specialist, usually your specialist is not going to provide preventative care for you. That's usually your primary care physician, such as like internal medicine, family medicine, under those. So I will write this question down for clarification for leadership, but from my understanding, preventative services are not done by a specialist.
All right, thank you both for that. And then, so if they're going to get a generic drug, do they have to pay the full amount for that before the deductible, or do they only pay a copay? Okay,
so if you have a prescription and it's not a generic drug, are you going to pay the full amount before deductible or only the copay? So again, not all plans have copays for prescription medications, but those that do, will have copays for the tier 1 and the tier 2 medications. And it's going to vary depending on the plan. So if you do have a copay and you go in to a Walgreens or CVS or a Costco, you're just paying that $10 or $20 or $50, whatever that copay is for that medication. Now, if it's a tier 3 or a tier 4 medication, those, regardless of the plan you have, it's not going to be a copay. It's going to go towards your coinsurance, or it's going to go towards your deductible and coinsurance. So again, we use OptumRx for our pharmacy benefit management company, and there are contracted prices for those medications when you go and pick them up through the pharmacy. One thing to keep in mind is that not all pharmacies are equal. If you have a medication and you go to Walgreens and you pick it up and it's not a copay, and the cost is, let's say it's $75. You could go to CVS and they might charge you $72.50. You can go to Costco, they might charge you $67.50. So there's contracted pricing, but it might be a little different depending on the pharmacy you go to. So kind of keep that in mind. But yeah, if it's outside of the tier 1 and tier 2, which might have a copay, but if it's a tier 3 and a tier 4, yeah, that whatever that price is for that med is going to go toward your deductible and coinsurance on your plan.
Thanks, Jim. Next question then is, what is the difference between copays and coinsurance?
A copay is, again, not all plans have copays, but if your plan does have a copay, it's going to be to see a specialist. It's going to be to see a primary care doc in network. It's going to be to pick up a tier 1 generic or a tier 2 medication. So a copay, whether it's 20 or 30 or 50 or whatever it is, you pay that to access that service, and it's before the deductible and coinsurance. And coinsurance is, again, the first thing that is your out-of-pocket expense. If you look at your plan, and it's going to vary depending on your plan, is your deductible. So, let's kind of walk on back to that Silver 4000 plan we talked about. That Silver 4000 plan, your deductible is $4,000 in the calendar year. If you've had $4,000 of out-of-pocket expenses for in-network eligible services, you've met your deductible. Then on that plan, there was 25% coinsurance, which means that until your total out-of-pocket expense on that plan was $8,500 and change, for every dollar of covered in-network services, you pay 25 cents on the dollar, we pay the other 75 cents. And then once your total accumulation hits your out-of-pocket max, then your coinsurance goes away. And then going forward, we're picking up eligible in-network services on your behalf through the calendar year. Each plan runs for, if you start on January 1st and you keep the plan in force, it runs for 365 days. On December 31st, that plan ends, and then you will get a renewal letter from us, and it'll say, okay, your 2022 plan, it's this plan, it's the same or a comparable plan. Your premium is going to be this amount if you're direct with us. If you're through the marketplace, we're going to estimate that your premium is going to be whatever it is, but it's subject to change because we're kind of relying on the most recent data that we get from the marketplace at the time we send your renewal out.
Thanks, Jim. Next question then is, does emergency coverage include hospitalization?
Hi there, Patty from Member Services. So for those emergency services that we talked about earlier, if you do have to go somewhere out of network, if you do go to the emergency room and then that does result in some hospitalization at that same facility, coverage does include that, that entire instance. Any follow-up after that would have to be done in network though.
Thanks, Patty. Next one then is a clarification on an earlier question. So thank you for putting that in. So they want to know, so if they go to a ThedaCare walk-in clinic, how would that be charged? So would they be paying their primary care physician copay, urgent care copay, or how would they pay for that?
Yeah, so for the urgent care, fast care, there are different copays, and it is plan specific. So some plans might have a $10 copay, some plans might have a $20 copay, and it would be a different copay than what you would pay for your primary care visit. But again, it does depend on your plan, just what amount that copay would be.
Thanks, Patty.
Mhm.
So next one then is, so their eye specialist is covered under their plan, but when they gave the card, they were told that the surgery center that they use for surgeries is not covered. So they basically want to know then what they do about their surgery if the place that they want to go to is not covered.
Okay, so this is Nicole in Member Services. So if the in-network specialist does not have or has surgical, how do I say this? If they're going to a surgery center that's out of the network, unfortunately, we would have to locate an in-network surgery center that he would have access to. So both the surgeon and the actual facility that you're having the procedure done at does have to be in-network.
Thanks, Nicole. Next one then is if they're diabetic and they have to get their annual vision test, is that considered preventative for them?
This is Nicole again. So diabetic vision is covered. It is applied towards deductible coinsurance. It is not under the preventative services. So we do cover it. However, it does apply towards your deductible coinsurance.
Thank you. And then next one then is if there's a husband and wife that are both on the Common Ground plan, how does the maximum out-of-pocket work? So do they both need to meet the family deductible to have their expenses covered, or can one single person meet their single maximum out-of-pocket and just have their services covered at 100%?
Yeah, that's actually a very good question. We get this question a lot. So on our individual plans, all the plans have a 12-month deductible, and they're embedded, which means that if you have a husband and wife, and let's say one of you, goes in for your wellness exam, it's zero cost, and you've got the good fortune that nothing else happens during the year, so you really don't utilize your plan very much. But the other spouse, they go in, they've got some chronic situations or something comes up. So as they utilize the services, as they incur any out-of-pocket expenses toward their deductible, toward their coinsurance, any co-pays they pay, those are all credited solely to their utilization of the services. So if we walk on back to that Silver 4000 plan, so if the person that's requiring some services, if they meet their $4,000 deductible, and now they're on 25% coinsurance, and they hit their $8,000 and 550 out-of-pocket max, once that individual runs through those requirements, then going forward, again, in-network eligible expenses are covered. That particular plan that we talked about before obviously has a family deductible and a family out-of-pocket amount. But if only one person is utilizing it, it's their services that they get credit for. You don't have to meet both. So that's a very good question.
Thanks, Jim. Next one then is, should there be a difference in what the provider bills the insurance carrier versus the patient? And should they be billed for the same services?
Hi there, Patty from Member Services. So there shouldn't be, any difference. The provider will send the claim, to us for processing. And then once that claim is processed, you do get that, in-network contracted discount. But then on your explanation of benefits, it'll show what the total patient responsibility is for that claim. And then that total patient responsibility should match the billing from the provider.
Thanks, Patty. The next one then, we might have to have you call in just to verify, but they said if They have the silver 400 CSR plan, but their fact sheet reflects a $400 individual deductible, not 4,000. Is 400 correct? So just to answer this one, yes. If your summary of benefits says that your deductible is $400, then it should be. If there's any confusion on that, maybe call in to our member services team or email us just so we can look at your account and verify that. But if that's what your summary of benefits says, that's what it should be. But just check with us for sure on that one. And then it looks like the last one that we have is, can they use GoodRx to get cheaper prescriptions? So can they use coupons when they're picking up their prescriptions?
This is Jim. Here's my understanding of GoodRx. In fact, I use it for some things also. If you go to GoodRx and you're getting a coupon, my understanding with Common Ground from a claim standpoint is that you can then not run that expense for that medication through your plan. Okay. So if you use GoodRx and you feel you're getting a really good deal on that and you want to take advantage of that, you can do so, but the money you pay out of pocket toward that medication is not then going to process through to credit toward your deductible or your co-insurance on your plan.
That is correct, Jim. That's exactly. So it's the way that it is the way that I like to describe it's the actual money that you're spending out of your own pocket towards a medication that would apply to the out-of-pocket expense. So if you're using a coupon, that would not be actual money out of your own pocket. It takes off from the cost.
And also if you're running it through GoodRx, you're not running it through OptumRx. So that's another difference. And the other thing, and I'll just share this with you personally because I get some medications through GoodRx for a variety of reasons. And I asked my pharmacist, well, how can they charge so much less? And she said, well, you know what? They take your name and your name is now available to various marketing companies. So, and sure enough, I picked up a medication through GoodRx and I started getting a lot of email solicitations from viable companies, but for things I probably had no use for. So if you ever do go the GoodRx route, yeah, you can save a lot of money, but you will get some introductions to companies that you're wondering where the emails come from. Just wanted to share that with you.
All right, thank you. So it looks like that was the last question that we had. So again, thank you everybody for joining us today. We are going to be emailing out the slide deck. So as long as you provided your email when you registered, if you don't believe you provided it, you can contact our member services team and we can have somebody email that over to you. And we're also going to be posting a recording of this on our website next week. So you can always check back on that if you want to rewatch it. But other than that, we thank you for joining us today and have a great rest of your weekend.
Yep. Thank you, everyone. Have a great weekend. Take care.